Okay. You have to cut that off.
You're live.
Hello, everyone. I'm Dr. Jim Daly with Daly Manufacturing, and this is our monthly training. It's February here in North Carolina, and believe it or not, the temperatures are in the 70s this week. It's great, actually, but a little bit unusual for February here. We can have snow at this time of year. However, we'll get cold again, don't worry. But we are having a nice time here, enjoying the weather. We hope wherever you are enjoying some good weather as well. Today we're going to talk about liver health, and I named it Protecting the Protector because we need to protect our liver, but it also protects us. So this is a very good mutual relationship we have with our largest organ. First of all, some interesting facts about the liver. You may not realize this, but you do not actually have to be a dead person to donate a liver. You can actually donate half of your liver to someone that needs a liver transplant, and your liver will grow back pretty quickly. About 90% of it will be grown back within 2 weeks. It takes a few months to get completely back where it was. So there is such a thing as live organ donors when it comes to the liver. I don't think there's any other organ in the body that can do that. Certainly you can't do that with a heart or a lung or anything like that. So the liver is pretty unique in that respect. It's not possible, however, to make an artificial liver. Reason being, it's far too complicated. It's much more complicated than the heart is. For instance, we can make artificial hearts to pump blood, but we can't make anything that can come close to doing everything a liver does. The liver is our largest internal organ. And in fact, it's not just an organ, it's also actually a gland because it makes hormones and proteins and things to circulate through the body to be used by other tissues and organs. Now, a lot of people don't realize this, but if you're a scientist or a medical person, you probably do. The liver actually makes cholesterol and glucose in the body. In fact, most people with high cholesterol, it's not because they're eating too much cholesterol. It's actually because their liver is making too much cholesterol. The liver has become gotten to a place where it doesn't really recognize the cholesterol in your body like it should. And even when your cholesterols are normal or even high, it thinks you're deficient in cholesterol, so it just keeps making it. The cholesterol receptors are not working correctly. So we do a lot of things to try to lower cholesterol, things that inhibit cholesterol synthesis in the body, the statin type drugs, high doses of niacin, various things. But, you know, it really is a liver problem for the most part with high cholesterolemia. Some people inherit high cholesterolemia, familial hypercholesterolemia. It's a genetic trait. It's actually, if you inherit that trait from both parents, you're homozygous for it, it's a very, very serious disease. In fact, in the old days, most people with that didn't live past their 20s or 30s. They died very young as a result of the hypercholesterolemia that they inherited. Same goes for glucose in a way, not quite to the extent of cholesterol, but when people have high glucose concentrations in the blood, about half of that excess glucose is actually coming from the liver. There again, the liver's not recognizing, it's become insulin resistant, and it's not recognizing the insulin that's produced is causing the liver to, keep producing more and more glucose as the as it progresses, it becomes more and more of a liver disease. Um, the liver does not use glucose for energy, interestingly, even though it's a major player um, in managing glucose. It doesn't use it for energy. It's an exporter of glucose. Finally, the liver contains about 10% of the total blood in the body at any one time. So it's a very highly vascularized organ with lots of blood in it, and it's filtering that blood, making sure things that should not get through to the rest of the body don't make it there. Now, just what all does the liver do? Well, it does a lot of things, and I can't begin to tell you all of them. There's at least 500 different things that we know the body does. I don't know all of them. I don't know if anybody knows all of them. But there's been that many things identified as functions of the liver. Detoxification is a really big one. The liver makes enzymes that can break down toxins in the body and excrete them in various ways. A lot of times in the bile, it goes through the gut and goes out that way. But it detoxifies a lot of these chemicals. The alcohol is actually a pretty good example of that, because when alcohol comes into the body, some of it is metabolized in the stomach, but the rest of it goes to the liver, where it can be first acted upon by alcohol dehydrogenase, converted acetaldehyde, which is actually even more toxic than the alcohol itself. However, it is metabolized further and broken down into non-toxic substances. But that's one reason why the liver is pretty sensitive to alcohol and excess amounts of alcohol, because not only is alcohol in the liver, but then it makes it into acetaldehyde, which is even worse, and starts doing a lot of liver damage if you have too much for too long. It can handle small amounts of a lot of toxins, but you get excessive amounts there and you're in trouble. It processes and distributes different nutrients throughout the body. It's involved in nutrient storage. It can store up to about 3 years worth of vitamin B12. That's one reason why people that go on a vegan diet sometimes and don't get B12 as supplements or in their food, it takes a long time for them to realize that they're becoming vitamin B12 deficient, because the liver has stored adequate amounts that you can go for a long time without becoming severely deficient with B12. It's, well, like we've already said, it's involved in blood sugar control. It makes glycogen and stores it there. It can actually make glucose from other things, gluconeogenesis. It makes ketones if it doesn't get enough, and they're used in the brain particularly, just like glucose. It makes cholesterol. We've already mentioned that. And that's not a bad thing, really, normally, because you've got to have cholesterol. It's a very important thing in your body for making a lot of different hormones. It's involved in protein synthesis and breakdown. It's involved in bioproduction. In fact, it does the bioproduction, and then it sends it to the gut, where it's very important for absorbing fats. It has Kupffer cells in it, which you don't really think of usually when you think of the liver. You think about hepatocytes, which are the parenchymal liver cells, hepatocytes. But the Kupffer cells are actually macrophages that locate themselves in the liver, attached to the walls of the sinusoids, and they look through the blood that comes through for things that they need to get rid of. Actually, about a third of the number of cells in the liver are these Kupffer cells. However, they're not, as far as mass of the liver, they're not anywhere near that. They're much smaller than the hepatocytes are. So, but they're a very important function. But they also can do some damage. They're one of the things that cause a lot of the damage from alcohol are those Kupffer cells, because the alcohol and the acetaldehyde acts on those, they release cytokines, inflammatory cytokines, and you end up with a hepatitis from them that will do a lot of damage. So the Kupffer cells are involved intricately with the damage sometimes to the liver also. The liver also produces blood clotting factors. In fact, if you have if you have liver disease, you very well may not clot well. You may bruise easily. That's one symptom of liver disease. And the very worst case scenario of liver disease is cirrhosis of the liver, and you can see on the right hand slide here the liver that has cirrhosis and the liver on the left does not. I also want you to look at the blue arteries coming up there. One of those is not veins actually, there is an artery there, but the blue veins that come up there, the liver's kind of unique. It's a vein that goes into the liver there. Usually most veins go directly to the heart for redistributing the blood. However, in the case of the liver, the portal vein goes through the liver after going through the intestinal area and picking up nutrients and things, transports them to the liver to be processed, and then it leaves the liver and goes to the heart for redistribution. So the blood's been kind of cleaned up by the liver by the time it gets to the heart and recirculated. The one kind of exception to that is your fats and fatty soluble things. They actually don't go through that portal vein. They are absorbed into the lymphatic system, and they go and are released into the bloodstream prior to going through the liver. That's one reason why a lot of really nasty toxins that kind of hang around are fat soluble, because they bypass that first screening of the liver and can get to a lot of places that the water soluble ones do not get to. And this is an illustration of just how liver diseases progress. Typically, on the left here, you see a nice, fairly dark brown or reddish brown liver. That's a healthy liver. That's great. That's what you want. The next step is simple fat accumulation, a fatty liver. Don't have symptoms. Some people have mild symptoms, some nausea, some liver area pain sometimes, but most of the time people don't really feel symptoms at that early stage. Now, the next stage as that progresses is what they call a non-alcoholic steatohepatitis. At that stage, we're becoming more inflamed, and you will have symptoms, and you'll know it. However, the first two stages there are reversible. The last stage is irreversible. When you become cirrhotic, you have cirrhosis of the liver. That does not reverse. There's not much you can do for that other than a liver transplant, actually. Now, you might think, well, the liver, can't it just reverse since it regenerates? Can it just cure itself? Well, actually, no, it can't. It doesn't have the ability with cirrhosis to do that, because I don't quite understand this, and somebody else might. We can discuss that later if you want to. But the liver, if it regenerates, will just regenerate more of that cirrhotic material. It would be nice if you just cut it out and it would grow back a nice healthy liver. It doesn't work that way, unfortunately. So you really want to be very careful about liver disease because it's very difficult to treat once you get past the point of no return, so to speak. There are liver transplants, but the downside of that is several things. One, they don't always work, and two, if you are on do get a liver transplant, you have to be on immunosuppressing drugs the rest of your life, and that's not good for the new liver, and it's not good for you in a lot of ways. So it's really a bad situation to be in. So like we say, we need to protect our protector here. Well, what are some of the causes of liver disease? Well, this will be kind of a brief overview, but a lot of times when we think about hepatitis, we think about the viral hepatitis type diseases, the liver inflammations. Interestingly, it's not the virus itself that does the damage. It's the liver's response, immune response to the virus that's really harmful and what does the damage. In fact, people with AIDS are less bothered by hepatitis than people who don't have it because they don't produce that immune response against it. Not a good way of doing it, incidentally. Cirrhosis, we usually think in terms of alcohol with cirrhosis. There are other ways of having cirrhosis of the liver. In fact, hepatitis, bad enough for long enough, will develop into that. There's also acute toxicity. These things are like a Tylenol overdose that can really destroy your liver very quickly. It's not a way you would want to commit suicide, although it's possible. It's a very hard way to die, actually. Toxic mushrooms, the amanitas we have in this area, can do that. People will typically live about 3 days, I think, with amanita, a bad case of amanita poisoning. It can kill very quickly. And so you don't want to go around eating mushrooms you don't know what are. Now, I do eat mushrooms, and I pick wild mushrooms, but I'm very selective. I have to really know the mushroom or I don't mess with it. And I love wild mushrooms. They're great. But be very cautious and know what you're doing if you're going to do that. Hemochromatosis is an iron overload disease that can be very damaging to the liver as well. Now, you don't normally get that from taking too much iron supplements. It goes way beyond that. The people who get that normally are people who have a genetic disease where they don't control the absorption of iron. Iron is very tightly controlled, its absorption is, because it can be dangerous. So when you take iron, the body monitors your iron stores, and it shuts down the absorption of iron if you have plenty, unless you have a genetic defect that causes the hemochromatosis. And then you can get, from just ordinary diet without taking supplements, too much iron, and it can be fatal. So one thing I get kind of worried about is when people talk about, well, this mineral supplement is 100% absorbed. You never want a mineral supplement that's 100% absorbed. You want one that's 100% absorbable, maybe. But if you found a way to make it 100% absorbed, you'd have a very dangerous supplement. So that's something you've got to avoid. Non-viral hepatitis can be caused by a number of things. A lot of drugs, vitamin A overdose, chemicals. The excessive niacin can do that. If you're really taking the ultra-high doses of niacin, you can shut down cholesterol production, but you can also really mess up your liver in the process. So somebody that's using niacin to lower cholesterol should be, very carefully screened by their doctor, monitoring the liver enzymes to make sure they're not hurting their liver. It's a dangerous thing to do on your own. Most of the people who have run into that problem were taking at least 1,000 and usually about 1,500 milligrams of time-released niacin, and not niacinamide now, niacin itself, per day. And with that time release, it kept the levels very high in the liver for a long time, extended period, and did a lot of damage. So you've got to be careful and cautious about that. Don't use niacin to lower cholesterol on your own. It's just dangerous to do. Finally, we have NAFLD, non-alcoholic fatty liver disease. That's getting to be, and probably is, the most common liver disease now, because it's very highly related to obesity, to dietary fat intake, and learning more recently, fructose intake. Now, a lot of people who do studies in rats on NAFLD are using high doses of fat in the mice and rats, and you can induce it with that. But with humans, it seems to be, as far as diet's concerned, often the fructose is really doing the damage. But somebody who's very obese very frequently has at least the lower levels of NAFLD, but with no symptoms. Well, here we'll look at non-alcoholic fatty liver disease. There again, we're looking at a similar picture as to what we looked at before. The picture to the left is the normal liver. It's darker liver. Doesn't look quite as dark brown in this picture. But to the right, we have the lighter colored liver because of the fat globules in it. Also, it's a larger liver. The liver becomes enlarged because of all the fat it's storing. This can progress to hepatitis and eventually to cirrhosis if it's bad enough. I'll be honest, that's rare to get to cirrhosis from the non-alcoholic fatty liver disease, but it has happened and it can happen. Well, the reason I was giving this talk this time is because of a study that just came out in the Journal of the American Medical Association. And they were talking about the effect of a low free sugar diet versus usual diet on non-alcoholic fatty liver disease in adolescent boys. This is a disease that's becoming very prevalent in young people in recent years. And that has been very unusual. Usually it's a disease of people in their 40s and 50s. Now we're seeing it in teenagers, and in this case preteens. These boys were aged 11 to 15 and 11 to 16 with an average age of 13 that were diagnosed with this disease by MRI. So even though the liver doesn't use glucose for energy, it's very involved in glucose metabolism, as we said before. As it turns out, the liver is responsible for making sure the body has enough glucose and storing it. And if it doesn't, it makes ketones. However, fructose is metabolized a little bit differently by the liver. I won't go into the details of that, but the end effect is fructose is normally not converted to glucose very much, and it's actually converted to fat. So it doesn't bring up your blood glucose levels to eat fructose usually. It doesn't increase your glycogen storage, but it does go to fat storage. So it stores that energy in that particular method. For some reason that I'm still not sure about, it tends to be stored more in visceral fat, abdominal fat area, and in organs and the liver and pancreas areas. So for whatever reason, fructose has a unique metabolism that causes it to be stored differently. And it's pretty good evidence now that non-alcoholic fatty liver disease, along with visceral fat, can result from eating either too much dietary fat or too much fructose. And this particular study in JAMA assessed the effect of trying to reverse that process in these boys. There again, they were aged 11 to 16 with non-alcoholic fatty liver disease. And this was published last month, January 22, about, 3 weeks ago? So it's very, very new research. So the study design, they looked for boys. This was a dual location study. Part of the study was done at the Medical Center at the University of California, San Diego. The others were in Emory University Medical School in Atlanta. And between them, they identified 51 boys that they assessed for eligibility. 11 were excluded. They ended up with 40 boys in their study. They were divided into two groups of 20 each and randomized with 20 of them to receive a low free sugar diet. In other words, they didn't eat sweets. Now, you can still get plenty of sugars from starches, from fruits and vegetables and things like that. And they didn't control that. What they really controlled was, cookies, desserts, and particularly soft drinks that are very loaded with high fructose corn syrup, or in some cases just sugar, which isn't much better. Sugar is 50% glucose and 50% glucose. So it's hydrolyzed to the two simple sugars very quickly in the body. So it's really just like eating simple sugars to get sucrose, the monosaccharides. The other 20 boys were randomized to a usual diet. They just ate their normal thing and went on. And it was only an 8-week study. Very short term for a human study, actually. Well, here's kind of an overview. Average age was 13. The subjects, as I said before, were either in Atlanta or San Diego. The primary outcomes were the hepatic steatosis, the fatty liver, as measured by MRIs before and after. The low sugar group had a 7.6% decrease in the fatty liver content. That's in 8 weeks. Now, this is something that had been developing over years. To reverse it to that extent in 8 weeks is actually pretty good. The usual diet group had a 0.8% decrease, which probably was due to the fact that they were probably watching their diet more closely than they normally did, or they wouldn't have decreased at all. But that happens in studies, in human studies all the time. That's one advantage of animal studies. They don't do that. They don't get to choose what they eat. But at any rate, this was a very good outcome, and it really showed clearly that changing your diet can make a big difference in non-alcoholic fatty liver disease. I would really love to see more data on whether a person who remains obese but eliminates those over a longer period of time, how that affects the non-alcoholic fatty liver disease. Don't know that yet. Now, here's some of the actual raw data, and you can look at the top area that's highlighted in yellow and look at the MRI scans. You can see that the percent 23 to 15 in the intervention group, 19 to 18 in the usual diet group. And very highly significant. Uh, if you look at, I also found if you look right below that under secondary endpoints, the liver enzymes that you use to measure liver damage were not that elevated. You didn't necessarily look at those things and say, wow, you guys have a problem. You couldn't diagnose that earlier stage liver disease by those liver enzymes very easily. Most of the time, if you go to a doctor and you have liver enzymes like that, they don't really worry. Well, anything can do that. And they're right, actually. It can. If you painted a room with one of the old type enamel paints that have the polar solvents in there, acetone or whatever they use, the next day you would have very elevated liver enzymes. It works that quickly and easily. So a lot of things can elevate those liver enzymes, but it's transient. They go right back down. So a doctor wouldn't have looked at those enzymes and been very worried normally, because it's something happens. However, if you keep going back and you always have high liver enzymes a little bit, they might get suspicious. The other thing that was interesting to me, if you look down here where it says homeostasis model assessment for insulin resistance, HOMA-IR, that's an indicator of insulin resistance in people. You get that from a fasting blood sugar / insulin concentration. There's a calculation to do that. That gives you an indication of how sensitive or insensitive you are to blood glucose and how your insulin responds to it, or how you respond to the insulin. And turns out the both were not highly insulin resistant, but insulin resistant. And it dropped in the intervention group. They become more insulin sensitive, whereas it got worse over that period of time in the usual diet group. They became more insulin resistant. So we see that it also affects insulin sensitivity, and that is a known complication of non-alcoholic fatty liver disease, is insulin resistance. That's you're really starting down the road toward diabetes, type 2 diabetes, when you have the NFLD. So that's something that you really have to kind of look out for. Now, I will say this, we have daily Livovite, and we'll talk about it a little bit in a minute, but, to say that you can take Livovite and then go out and drink all the Cokes and Pepsis you want, I'm not going to tell you that. To go take Livovite and say, yeah, I can go out and get drunk all the time, doesn't work that way. It helps. It really will help. In fact, it can help quite a bit, but you just can't overcome bad diet with supplements, period. You want to use supplements to enhance a good diet where you can. And the fact of the matter is, you never get away from liver toxin completely. They're out there in the environment. If you are waiting for a bus and there's trucks coming by, diesel trucks, and you're breathing those fumes in, you're doing damage to your liver. Now, the liver will take care of it, usually in that kind of situation. It's not going to be severe enough, bad enough, because the liver is pretty resilient. But, you don't want to push your luck either. So, with that, I'm going to take just a minute to talk about Livovite, and I'll grab my stuff over here. I'll be right back. Okay, Livovite, and you can see it here, has a number of really good ingredients for your liver. It starts out with methionine, choline, and inositol. Okay, these are basically categorized as vitamins, not exactly. Methionine is an amino acid. Choline has become categorized as a vitamin in recent years. Inositol is not yet, but it's kind of lumped in with the B vitamins by a lot of people. But these are all important nutrients for your liver. In fact, one of the symptoms of choline deficiency is fatty liver. So it is possible to not get enough choline if you have a really lousy diet. And if you're eating a good diet, you don't normally have to worry about choline. Honestly, there's a lot of it in good foods. But if you, a lot of people don't eat good diets, so we put it in there to give you a little bit of extra assurance on that. We also have taurine in there, which is a very good liver protector. It actually is one of the things that the liver makes bile from, and it's a very important liver protector and bile maker. We've got milk thistle extract. This has something called silymarin, which is really, really excellent protector of the liver. In fact, silymarin is also a prescription drug for people who get the mushroom poisoning. Treated early enough, it can save a person's life if they eat those toxic mushrooms like the amanitas we have here. But it's also can be in supplements, and in this case we put it in our Livavite because it is protective against some of these liver toxins, a lot of the liver toxins actually. And we also have some other herbs. Let's see what we got. Black radish root. And right here in the Journal of Medicinal Food, we have an article about black radish root that was just published last September. And you can see here, black radish root was hepatoprotective against carbon tetrachloride poisoning in the liver. Very, very protective actually, very good. We also have beetroot in there, article here on beetroot, and actually I'm just showing you one article, there's lots of them. This one was in the British Journal of Nutrition about the protective effects of beetroot juice against let's see, well, I don't see how they induced the liver damage there, but it did detoxify. I think that was also against carbon tetrachloride. Golden seal is in there, and it has a lot of good research on there. It protected against Tylenol, acetaminophen-induced hepatotoxicity in rats. They didn't do that in people, but it's very protective against the Tylenol toxicity. So we have these herbs in there that can really protect your liver as well. Now, we don't want you to, push your limits. We don't want you to go out and say, I can do what I want to if I do that. However, if you suspect that you do have problems with your liver, if you're very overweight, you might consider it. If you have unexplained nausea sometimes, pain in the liver area, which is right above the stomach, and you have risk factors for liver disease, it's something you should consider. If you do drink excessively, I would urge you to stop. However, until you're successful, this would be something very good to use. If you're exposed to agricultural chemicals and other kinds of chemicals on a regular basis, you're probably going to need some protection for your liver because that kind of exposure is very damaging. So with that, we're going to wrap it up. I think we'll take some time to ask questions and have some discussion here. If people here want to discuss this or questions or observations, please speak up now. Speak up loudly so they can hear you. But let's go ahead and see. Does anybody have any questions or observations they would like to include in this? We may not have anybody here that does. Sorry, I don't know if we have people online who might have questions. Are we seeing anything there, Jonathan? Well, no questions, people. I hope you enjoyed this. I hope you learned something. And I hope that this will help you maintain a healthy life. And thanks for joining us. Good day.